Oh, okay. Whoa. Oh, gosh. Oh. Bowling badness, rescue efforts gone really wrong, and you know what I always say, don't pull it out. Today, we are breaking down and reacting to all of the imaginative medical scenes and colorful injuries from Happy Tree Friends. Let's dive right in. Oh. Okay, be careful. Oh! I was about to say, be careful, there's glass on the floor. People step on glass all the time. Not necessarily getting impaled through the chest wall. Oh my gosh. Oh, that's kind of funny.
That's pretty funny.
Oh no, so this is classic. What I tell everybody, don't pull it out. If you do pull it out, uncontrollable bleeding, might not be able to get to it in time, and then you bleed out and pass away. Just shoot out. Trying to re-stab it in there, don't do that. You're gonna cause more injury. This is a lot of blood. A normal human has about 10 to 12 pints of blood. If you lose 4 or 5 pints of blood in a very short period of time, that is a potential catastrophic disaster. See, there you go, cork it. Right mid-chest, what are the structures that you might actually be hitting? Really the heart, maybe if you're high enough, you're hitting the aorta or the superior vena cava that's coming in. But is it gonna be a big stream like that? It could, but likely it needs to be pulsatile. Even if you hit one of the ventricles, there is a pause or decreased pressure. Oh my gosh, whoa, my goodness. That's funny. Oh no, piercing through the tongue. People get their tongue pierced. Sometimes it bleeds, sometimes it doesn't. But if you get an injury to your tongue, they bleed a lot. Sometimes you do have to sew up a laceration. Really hard to do. You're always moving your tongue. Oh, and then they're lighting gasoline. Oh my gosh. Holy cow. The anatomy after the explosion is a little off. Typically, the ribs are not going to be pointed in that direction. They will explode out, but they wrap around perpendicular to the ground versus north-south like it is here. Oh, no, 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 no. Do not go get the ball. Just get a new ball. Oh my goodness, look at the helicopter ready for action. Oh my goodness. That's not a traffic helicopter. That's a medical helicopter. Oh my gosh. The left hand, it looks like an impaled object. If you have a very small splinter somewhere, you can take it out. But if you have a large object, please don't take it out. Get to the hospital. We can get an image of it, and then we can have a specialist, orthopedic surgeon, hand surgeon, vascular surgeon available right then and there to actually repair and take care of you in the operating room. Oh no, falling from a great height. We're falling greater than 3 times our height, potential significant amount of force that can generate a lot of injuries. Oh, but no, we got the helicopter in the way. Obviously, these injuries from the helicopter blade is not compatible with life, but people do come into the emergency department with helicopter-related injuries, sometimes missing limbs, fingers. The other thing is helicopters do crash, cervical spine fractures, fractures of the ribs, pneumothorax, hemothorax. Oh man. For that moose, that type of rescue, it's usually a basket that they're being lifted out of, not a stretcher like that, so you wouldn't actually have wheels on that bottom. Oh, okay. Whoa. Oh gosh. Oh. Interesting, the cervical spine bone that's sticking out looks more like a humerus bone versus the cervical spine. So very funny, the anatomy that we're seeing here. Hey, we got a strike. Woo-hoo! Just impale the orbits. The orbits, we also call them the globes, your eyeballs, very sensitive structures, very painful actually to touch on the outside, especially your corneas. If you have them open, we call it an open globe injury. The fluid inside the eye is very special, so when it leaks out, we could try to replace it with a synthetic, but it's never the same. Uh-oh. common injuries from the bowling alley: blunt injury to like your foot or your toe. You drop the bowling ball on it, so you can have a crush injury, fracture, could have a laceration. You can get your fingers stuck in the ball. You can cause yourself a dislocation or fracture the finger. Oh no, you probably would still have your eyeball attached because you have 6 muscles plus the blood vessels and the optic nerve all coming out the back. So it's tethered in there pretty good with also some other connective tissue. This many chaotic injuries, even animated ones, can definitely get your adrenaline going. If your day has you feeling just as stressed as this cartoon, you might want to consider Chillax by my company Life Happens, the doctor formulated stress support supplement. Check it out at lifehappens.com or on Amazon. Impaled object to foot and leg. Remember, don't remove these, just call for help. The knife higher up in the leg, I would not remove because it's probably tamponading a vessel. It might even be stuck in the bone. Make sure you wash it out really good and cover the person for tetanus as well as bacterial infection that might set in. Why is everybody in a jar? Like smaller versions of themselves. Are we going to grow them in a plant? What the? What just happened? Oh my, oh, crack open like an egg. Oh, I get it. Okay. Getting another creature's or person's blood in your eye, your body will absorb that. If there's anything abnormal within the blood, meaning like an infection, you can actually get it transmitted to you. Plus just foreign body to the eye, typically about 10 to 15 minutes at an eye wash station. And then we need to do an exam to see if there's any injury, foreign bodies. We do see a lot of crush injuries. We'll see people who get smashed in car accidents, machines, run over. It destroys the tissue. It causes a lot of cellular breakdown, increase the risk of some rhabdomyolysis, which is basically breakdown of muscle tissue, as well as elevated potassium levels, which then can lead to renal failure and cardiac arrhythmias. You're also seeing the glass shards going to the foot, and they can actually break off. Sometimes you won't even know that there's a glass shard in there for a little while. X-ray can easily help us identify if there's a foreign body there, but getting it out also has its difficulties. No, don't do that. Okay. Typically, this type of electrocution is an alternating current, causes flexion and you can't release. Burning of the nerves, cardiac arrhythmias, going into like VTAC, VFib, can also cause muscle breakdown as well as elevated potassium levels too. Oh my gosh, add insult to injury. Learn from your mistakes. You can't just go do that. Oh no! You're on fire! Run! Depending if it's 1st degree burn, which is not open skin, just painful red burned skin. Then you have a 2nd degree burn, which could be those blisters. Once those blisters open, that's when you really need to take care of the tissue by keeping it quite moisturized. If you have a 3rd degree or 4th degree burn, these are going to have surgical interventions. Smart. This is good, okay. Stop, drop, and roll. Or you get a fire blanket or anything you can do to kind of suffocate it and get it to stop. The burn has already caused the damage. Put ice on it. Well, that's just going to soothe it for what it already did. Whoa, well, how did they just go up in flames? If you're having that much flame around your face, typically people would get like flash burns. It's not something that's continuous like this. You look at eyebrows, you look at eyelashes. If there's nose hairs that have been singed, blackness in the back of the throat, that gives you a high suspicion that there's something probably impending that's bad relating to their airway. I wasn't expecting that. Wood, blunt fence like that, hard to do that. I have never seen that come into the emergency department, but I've seen rod iron fences. We actually see people who fall from great heights out of trees, off roofs. Somebody lands on their feet. Oh, that's amazing. But then they fracture a couple bones in their back because the force goes shrink. Oh, constricting because taking away the oxygen, but it wouldn't necessarily constrict because you're still breathing out a little bit of oxygen as well as CO2. Oh my gosh. So that only took a few seconds. Even if you're out without oxygen just for a few seconds, you shouldn't be totally unconscious, so to speak. I can hold my breath for about 2 minutes. I might pass out, but then if I'm still not getting oxygen, I probably have about 6 to 7 minutes before my oxygen saturation curve goes from 100% to 90 and then all the way down. That's hilarious. That's pretty good. Until it's gonna cause a neck problem. What? What the heck? How did that happen? Rips the body apart. That's crazy. We do see my favorites. Classic brain with the gyre. Classic. And then we see tubular structures of intestines missing the omentum, as well as the mesentery. Oh, this is where you push it and get it spinning. Yeah. Oh, it's gonna sounds awful. Something bad's gonna happen. There's an airplane taking off. There goes your finger. Ooh, degloved. Degloving, when you pull off all the skin. The skin is the largest organ in the body. Really important. You can't really live without it. A lot of times it's thick enough that you might be able to actually reattach it and still have it function. A lot of times we see the degloving accidents in industrial industries as well as car accidents. Oh! I think he's trying to give CPR. There are instances when CPR is difficult. Maybe there's a lot of vomit, there's a lot of blood. Sometimes there's already a big indention in the chest wall from all the ribs that are fractured due to CPR. Oh! Lots of lacerations. These small puncture wounds probably can be removed. You do have major vessels of the face, especially they come off of the external carotid artery. Oh, good. Electrical fence just hanging out. I love it. Electrical injuries can cause cardiac arrhythmias, VFib, VTAC, burn your nerves, cause cardiac arrest. And how do you fix it? We use more energy again. Could cause rhabdomyolysis, breakdown of the muscle tissue. Really funny is the bone structure. They did a good job. At least with the fingers, you have your phalanx, so you have 3 pieces. That's pretty good for each finger. You know, we're missing a few bones. We should have 2 in the forearm on each arm. We should have 2 in the lower leg below the knee. Oh, the moose. Oh, ah. How many of you out there have pets that sometimes go a little rogue and cause a little nibble? We get people that suffer from animal attack and bites that will puncture in. You probably need to have these wounds really washed out and potentially opened up in the operating room because of the potential of getting bacteria inoculated or basically punctured into the bone itself. Oh my gosh. You have ones where the tissue is just so destroyed. Missing tissue, missing muscles. Pretty bad. Ripped off the covering of the abdominal wall. These small intestines are all jumbled up, typically in the middle, all attached by mesentery, which is how you get all the blood vessels and the nutrients. They always do depict them as stretchy. They are, because they are smooth muscles, so they do stretch. What is inside of the intestines? Poop, right? It's where our food gets broken down. We absorb the nutrients. We process it more. Oh. He saved the animal. He saved them. Oh. Oh. We got brain matter. We're doing our ABCs, trying to stabilize them. You gonna blow a whistle? You can swallow a foreign object, get it stuck in your esophagus, and feel like you can't breathe because it has this weird sensation, overlapping nerves, and potentially just pushing a little bit on the trachea. But the trachea is solid cartilage. It doesn't go all the way around except for one piece of cartilage, which is your cricoid cartilage. We have foreign bodies into your face. sometimes you can't get them out of the tissue, which freaks everybody out. If we try to go digging to try to get this out, we may not be able to find it. Oh, and the arrow. Look at this. The arrow compresses the eye, which we call the globe. This actually does happen when you have penetrating trauma to the eye itself. The fluid of the eye starts to leak out. There's synthetics that they can inject into the eye, so that's okay, but you don't want to touch it. Don't touch it! Happy Tree Friends is definitely an intense show that has provided us a lot of content relating to medical problems and injuries. So please be careful out there. If you guys enjoyed this, definitely check out this playlist right here. Please make sure you binge watch everything. Also, new year, new shows. Drop in the comments your favorite shows you want me to check out. And do me that favor, subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.